Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. New research demonstrates how common diabetic retinopathy is among Americans with diabetes. The data is published in the Journal of the American Medical Association. Here is some information about diabetic retinopathy. It is a condition that occurs as a result of blood vessels in the eye becoming damaged due to diabetes. It is a progressive disease that, if left untreated, can cause blindness. To prevent blindness, individuals with diabetes should have their eyes checked regularly. Researchers from the Centers for Disease Control and Prevention in Atlanta analyzed a representative sample of over 1,000 Americans aged 40 and over to determine the prevalence of diabetic retinopathy. The presence of diabetes was determined by participants reporting that they had received this diagnosis in the past or via blood test. All participants had their eyes tested to determine the presence of diabetic retinopathy. The overall prevalence of this disease was 28.5% among U.S. adults aged 40 and older with diabetes. The prevalence of vision-threatening cases of diabetic retinopathy among these individuals was over 4%. The condition was slightly more common among men than women with diabetes. It was also more common among non-Hispanic blacks than non-Hispanic whites. Being male was associated with having more than twice the risk for this condition, while having higher levels of hemoglobin A1C, a sign of uncontrolled diabetes, increased the risk by 45%. Both longer duration of diabetes and higher systolic blood pressure were linked with having a slightly increased risk for diabetic retinopathy. We spoke with Dr. Jinji Zhang, one of the investigators of this study, who offered some further insight.
If you have diabetes, take good control of your diabetes and get your eyes examined regularly. Finding the problem early and treating it right away can delay or prevent the loss of your vision.
Today's research demonstrates how common eye disease is among Americans with diabetes and highlights some of the most important risk factors for the condition. If you have diabetes, have your eyes checked regularly. For Insider Medicine in Depth, I'm Dr. Susan Sharma.